Assalamualaikum warahmatullahi ta'ala wabarakatuh. When I was in medical school, I read an article regarding a result of an RCT of male circumcision and how it shows reduction in HIV transmission. I said to myself, that's really interesting. So I wonder what happens to the issue 15 years later. A lot, and it's really interesting and controversial, I must say. So let's go through the issue together. Before that, I need to warn that for certain images, some viewers may find them uncomfortable. I'll be focusing on male circumcision. Female circumcision is a separate topic altogether. Male circumcision is the most common surgical procedure that involves removal of overlying skin over the tip of penis, called foreskin or prepuce, exposing the gland of penis all the time. The practice of circumcision dated back thousands of years ago. There was a wall painting found in Egypt depicting male circumcision dated back to 2200 BC, which is 4000 years ago. From religion point of view, based on the Bible, the practice of circumcision started during the period of Prophet Abraham. In the book of Genesis, God said to Abraham, "You shall be circumcised in the flesh of your foreskin as a sign of covenant between you and me." To date, it is estimated that nearly 40% of men in the world are circumcised. It is not a surprise that many of circumcised men belong to the Abrahamic religion, namely Judaism, Islam, and Christianity. However, for Christianity, circumcision now is uncommon and mainly being practiced by the oldest branch of Christianity. There are also cultural rites that promote circumcision as a rite of passage to manhood, and it is associated with self-identity and masculinity. It happens in many tribes in Africa, Aztec civilization, and probably Mayan civilization as well. Interestingly, there are several places currently also practicing male circumcision. More than 90% of Filipino men are circumcised, despite majority of them now are Christian. South Korean, surprise surprise, 80% of men are circumcised. This is surprising as more than 50 years ago, none would have been circumcised. They believe the Koreans were exposed to the United States Army during the war and it catches from there. And United States estimated around 70% of men are circumcised, with majority of them circumcised when they were babies. Apart from religious reasons, there are also medical reasons why men need circumcision. The normal foreskin can be retracted easily, but some surgical help may be needed in the case of tight foreskin, called phimosis. There is also recurrent infection of the glands of penis, called balanitis, that warrant circumcision. The first ever connotation that circumcision may reduce HIV transmission came from a letter published in New England Journal of Medicine in 1986, when the author Dr. Shukla wrote his observation and possible linkage. He said that venereal diseases are more common in uncircumcised men, so maybe HIV as well. And he proposed a mechanism that is not far off from today's understanding, that during erection, the inner lining of a foreskin is exposed, increasing risk of transmission of infection. He also gave his observation that perhaps the lower rate of HIV in the US, probably because of a high rate of circumcision there. There were many subsequent studies studying the relationship between HIV and circumcision, but none were randomized trials. In a meta-analysis by Weiss in 2000, it was shown that in population-based studies, circumcision was associated with 46% reduction of HIV infection, while in high-risk patients, circumcision was associated with much higher reduction, which was 70%. Because of these interesting findings, the researchers in early 2000s, sponsored by National Institute of Health, in which the famous Dr. Fauci was the director at that time, started to initiate proper studies addressing the questions in randomized fashion, which is, if we randomize HIV negative men, one group got circumcised and another did not, and we follow them for 2 years and see which group developed more HIV infections. And that's what they did. There were 3 randomized control trials done involving different areas in Africa. The first study was performed involving 3,000 men in South Africa. It showed that male circumcision reduced risk of HIV infection by 60%. The other two studies, which in combination involved nearly 8,000 men, also showed very significant result that circumcision has 50 to 60% reduction of HIV infection. The risk of circumcision was also low, only less than 4%. If you want to compare that result with latest RCTs, the SGLT2 inhibitor trials, the cardiovascular protection that it gives would be around 30 to 40% reduction. And already people rush to prescribe SGLT2 inhibitor. The trial results were so significant that all the RCTs were stopped early, and the group that were not circumcised were offered circumcision after the trials have ended. The Cochrane Library did a meta-analysis of the three trials and found that the combined result showed 54% reduction of HIV infection in heterosexual men with circumcision. This was published in 2009, and since then there is no more significant RCTs on heterosexual men being done. What is the proposed mechanism? How does circumcision work in reducing risk of infection? Preliminary studies by Patterson in 2002, he took the foreskin of circumcised men, and foreskin has a bundle of cells that were targeted by HIV to enter the body, namely Langerhans cells or marked by CD1A. There were also CD4, which is T cell, and CD68, which is macrophage, which are also targeted by HIV, but they were not as plenty as Langerhans cells. Subsequent study by McComb in 2006 showed that not only Langerhans cells were abundant on the foreskin, they were especially plenty on the inner surface of the foreskin and also more superficial. The image on the right showed the exposure of the inner side of the foreskin during erection, which could be the place for HIV entrance. This area would not have been there if the men are circumcised. Follow up the impressive result of the three RCTs, the UNAIDS and the WHO released a statement that covers 10 conclusions. Two of the conclusions said that male circumcision reduces risk of HIV transmission in heterosexual relationship beyond doubt. They actually mentioned beyond doubt. The circumcision does not offer complete protection, and that's an important message as well, just in case circumcised men just go around and do things. WHO and UNAIDS came up with a voluntary medical male circumcision, VMMC, to promote male circumcision. It involved 15 African countries, and up to last year, there were 23 million men had undergone the circumcision, an estimated saving of 16 billion USD. The countries were chosen as the rate of HIV among general population was high and the rate of male circumcision was low. Few years later, seeing the success of such program, they come up with another one called Early Infant Male Circumcision, EIMC, which targeted infant male of less than 2-month-old for circumcision. EIMC is cheaper than VMMC and in longer term would offer cost-saving HIV prevention. It also less complication, and there was no issue of increased infectivity during healing process if circumcision happens in adult men. Sounds good, isn't it? So not only male circumcision reduces risk of HIV transmission, it also may reduce other infectious risks as well, such as syphilis, herpes, and human papillomavirus, which probably would reduce risk of cervical cancer in the partner. Another benefit, and many can relate I'm sure, is that who would want to go through the agony and embarrassment of having the foreskin stuck in the zipper? It is also important to know the established risk of male circumcision. The surgical risk, bleeding, infection, etc. account for roughly about 4% based on RCT or VMMC program, and most were not major at all. The first RCT in South Africa showed circumcision had increased the risky behavior among circumcised men, which is a concern. But despite that, the result was still overwhelmingly positive. There is also theoretical risk that while the wound was healing, the raw area may increase risk of infectivity, hence avoidance of 6 weeks of sexual activity after circumcision. If male circumcision was so great in preventing HIV transmission, how come, at least to myself, have not heard of it being promoted all over the world. We have three big RCTs, observational studies, meta-analysis, and ongoing VMMC and EIMC program. Are those not enough evidence? Well, this is when it gets interesting. The American Academy of Pediatrics took a stand in 2012, endorsed by the American College of Obstetrics and Gynecology, that the health benefit of newborn male circumcision outweigh the risk. Remember, 70% of men in the United States are circumcised. Majority happened when they were newborn. Newton's third law stated that for every action there is an equal and opposite reaction. The encouragement for infant circumcision by the AAP did not sit well with other developed countries. For example, this author presented a different view that he claimed represent other developed countries in Europe, Canada, and Australia. He counterclaimed all the benefit that was mentioned regarding the circumcision. The same author also wrote in 2018, mentioning that apart from the AAP statement in 2012, an anonymous CDC working group was also working towards the same direction in 2014. He also argued against the circumcision, quoting policies from Britain, Europe, Australia, Netherlands, England, and Canada, all against the idea of universal male circumcision. What's the reason of all these societies went for such policies? They mentioned that the risk of circumcision was downplayed. They also highlighted the benefit of foreskin, which may have some function including sensation. He also questioned the generalizability of the African RCTs to the developed countries, which the rate of HIV infection via heterosexual relationship is less than 30%. One of the main arguments as well is the issue of ethics and consent. They argued that infant circumcision is against ethical conduct, as the baby might have a different view when he reached age of consent. Regardless whether we agree with male circumcision as a public health policy, we must not forget other methods for HIV preventions are available. There is a behavioral change strategy, such as abstinence and avoidance of sex and remaining monogamous, which may be difficult in certain segments of societies. Consistent condom usage is also recommended. Interestingly, Cochrane review in 2002 showed 80% risk reduction of HIV infection, not 100%. For community transmission, promoting condom use failed to show a decrease in HIV transmission. This was based on Cochrane review in 2014. With the advancements of medicine, now we have pre- and post-exposure prophylaxis to be taken before or after high-risk behavior. So why am I interested with this non-nephrology topic? We all have biases, number one. It's just that we have to be aware of it so we can make sense of certain argument. Obviously, for somebody coming from a background that makes male circumcision necessary, this finding of medical benefit proven by science, at least the science of our time, is the height of interaction between cultural or religious heritage and scientific discovery. Number two, however, I believe it is important for me to say that although the finding may help me finding some objectivity or reasons in certain religious recommendation, we cannot use scientific evidence as ultimate proof that certain religion is correct. Why? Because science is ever changing. Something which is clear-cut true now may not be so true in the future. If that happens, are we going to change our belief as well? How long were we stuck in the paradigm of the Greek medicine that diseases were due to imbalance of humor in our bodies before the discovery of bacteria, microscope, and biochemical analysis? The Newton's law now has its limit in view of Einstein's theory of relativity. Science has its role for us to understand the world that we live in at this moment, but by its true nature, science will change. Hence, using something that are bound to change to prove something that we Muslim believe is something coming from God, the ever-knowing God, for me, that does not sit right. And number three, we can see interesting discussion that blew up in the scientific community a couple of years ago. We have an intervention that shows 60% reduction of HIV infection, proven with the 3 quality randomized trials. If this is something related to medicine, even with a lower percentage of benefit, like SGLT2 inhibitor, people all over the world will jump into it, racing to update guidelines and prescribe, even though people can use and argue that their population was not included in the studies, the side effect profile, and so on and so forth. For me personally, that reveals an inherent bias that all of us would have. Hope you enjoy listening to my talk. Don't forget to subscribe and enjoy the rest of the content.